Good morning, Facebook followers. My name's Eric Kestela. I'm with the Michigan Trucking Association. We're at the Center of Truck Safety. Today we're going to talk about what employees need to know about DOT drug and alcohol testing. Again, my name's Eric Kestela. The Michigan Trucking Association's mission is to serve the interest of commercial motor transportation through the advocacy, education, training, networking, and public image building. MTA is home to and the Center for Decision Driving and our MTA skid pad. It is only with the support of MTA members that these projects can continue to provide safety, training, and simulator or skid pad experience for CDL drivers at little or no cost to the Michigan trucking companies. What employees need to know about DOT drug and alcohol testing. What are you responsible to do if you have a safety-sensitive function job? Let's go over these rules and information about what you're required to do if you have a CDL license and you do a safety-sensitive job. You are just entering the transportation industry, performing tasks defined by the US DOT as safety-sensitive, such as working on pipelines or driving a truck. When you're subject to the DOT workplace drug and alcohol testing, here are some of the basics you need to know about the DOT's program. Anyone designated as a DOT regulations as safety-sensitive employee is subjected to drug and alcohol testing. What follows is the overview of what jobs are defined as safety-sensitive function subjects to be testing. So if you work for the aviation, FAA, commercial motor carriers, the FMCSA, maritime, U.S. Coast Guard, pipeline, PHMSA, railroad, FRA, or the transit, the FTA. These are all the people who are subject to DOT testing. Commercial driver license holders who operate the commercial motor vehicles of 26,000 pounds GVWR or greater, or operate a vehicle that carries 16 or more passengers, including the driver, or are required to display a DOT placard in the transportation of hazardous material. See FMCSA Regulation CFR Part 382 for commercial motor carriers. The tasks you perform qualify you as a safety-sensitive employee, not your job title. Also, some employees, like managers and supervisors, may be qualified for these jobs but not currently performing them. Do they have to be tested as well? In most cases, yes. If an employee may be asked at a moment's notice or an emergency to perform safety-sensitive job, be sure to check the industry-specific regulations for further clarifications. Why are safety-sensitive employees tested? The short answer is for the safety of traveling public, coworkers, and yourself. The longer answer is the United States Congress recognized that the need for drug and alcohol-free transportation industry and in 1991 passed the Omnibus Transportation Employee Testing Act, requiring DOT agencies to implement drug and alcohol testing for safety-sensitive transportation employees. The Office of the Secretary's Office of Drug and Alcohol Policy and Compliance, ODAPC. They're the ones that publish the rules on how to conduct these tests in Part 40, what procedures to use, how to return an employee to safety-sensitive duties, that provides authoritative interpretations of these rules. DOT agencies write industry-specific regulations spelling out who is subject to be tested, and when and in what situations. Industry employers implement the regulations that apply to them. The benefit of all affected by DOT regulations is each industry regulations must adhere to the DOT testing procedures found in Part 40. FMCSA requires that your employer gives you educational material, a company policy on drug and alcohol testing, procedures to help you comply with the testing procedures, and limited consent form for the Drug and Alcohol Clearinghouse. You must not use, possess alcohol or an illicit drug while assigned to perform safety-sensitive functions or actually performing safety-sensitive functions. You must not report for service or remain on duty if under the influence or impaired by alcohol. If you have a blood alcohol of greater 0.04 If it's .02 to .03, some regulations do not permit you to continue working for up to 24 hours. Having used any illicit drugs, you must not use alcohol within 4 hours for reporting for service. You must not report for duty or remain on duty when using a controlled substance unless pursuant to the instructions of an authorized medical practitioner. You must not refuse to submit to any test for alcohol or controlled substance. You must not refuse to submit to any test by adulterating or substituting your specimen. DOT tests are conducted only using urine specimens. The urine specimens are analyzed for the following drug metabolites: marijuana, cocaine, amphetamines, opioids, and phencyclidines. What drugs does not DOT test for? Drugs they collect using urine. Alcohol they collect breath or saliva. Specimens collected for drugs or alcohol. Cannot use prescribed medications over the counter, drugs, or perform safety-sensitive functions. Prescription medications and over-the-counter drugs may be allowed. However, you must meet the following minimum standards. The medicine prescribed to you by the licensed physician, such as your personal doctor. A physician has made good faith judgment that the use of the substance at the prescribed dosage is consistent with safe performance of your duties. The substance used at the dosage it's provided. If you are treated by more than one physician, you must show that at least one of the treating doctors has been informed of all the medications that you are prescribed and has determined that the use is consistent with safe performance of your duties. Taking the prescribed medication is not prohibited by DOT regulations. You must discuss with your company the prescriptions you are taking with your employer so they are also aware of what you're on. If you're using over-the-counter medications, check with your physician or pharmacist. When carrying medications with you while working, you must keep them in the prescription bottle with the dosage and the doctor's name. When carrying an over-the-counter medication, carry the packaging that explains what it is and what side effects there are. Consult the FMCS regulations before deciding to perform safety-sensitive tasks. Also refer to your company's policy regarding prescription drugs and who you need to talk with before performing safety-sensitive drug tasks. When will I be tested? Safety-sensitive employees are subject to drug and alcohol testing in the following situations. Pre-employment. Before you start work, you have to have pre-employment testing. Reasonable suspicion or cause. So if they suspect that you're under the influence of drugs or alcohol, they may test you. A random testing program. If you leave work and you have to, in order to come back, you have to do a return to duty test. And then follow-up tests. And if you have an accident, there's post-accident testing. As a new hire, you are required to submit a drug test. The employers may, but are not required to conduct the alcohol testing. Only after your employer receives a negative drug test may you begin to perform the safety-sensitive functions. This also applies if you're a current employee transferring from a non-safety sensitive function into a safety sensitive position, even if the same employer. So if you're changing jobs or being hired in as a new employee, you have to go through the pre-employment drug testing and have a negative result before you can resume those tasks. Reasonable suspicion or cause. You're required to submit to any test, whether drug or alcohol or both, that a supervisor requests based on a reasonable suspicion. Reasonable suspicion means that one or more trained supervisors reasonably believes or suspects that you are under the influence of drugs or alcohol. They cannot require testing based on a hunch or a guess alone. Their suspicions must be based on an observation concerning your appearance, behavior, speech, smell that are associated with drug and alcohol use. Random testing. You are subjected to unannounced random drug and alcohol testing. Alcohol testing is administered just prior to, during, or just after performing safety-sensitive functions. Drug test administered just prior to, during, or just after the performing of safety-sensitive functions. No manager or supervisor, official, or agent may select you for testing just because they want to. Under DOT regulations, employers must use a truly random selection process. Each employee must have an equal chance to be selected and tested. Just prior to the testing event, you will be notified of your selection and provided enough time to stop performing your safety-sensitive function and report to the testing location. Failure to show or for a test or interfering with the testing process can be considered a refusal. If you are involved in an accident or an event meeting certain criteria of the DOT agency, a post-accident test will be required. You'll be required to take a drug test within 32 hours, an alcohol test within 8 hours. You are required to remain available for this testing and are not permitted to refuse testing. Remember, safety-sensitive employees are obligated by law to submit and cooperate in drug and testing alcohol mandated by DOT regulations. Return to duty. If you violated the prohibited drug and alcohol rules, you're required to take a drug and alcohol test before returning to a safety-sensitive function for any DOT-regulated employer. You are subject to an unannounced follow-up test at least 6 times in the first 12 months following your return to active safety-sensitive service. Return to duty tests must be conducted under direct observation. Follow-up tests. The amount of follow-up testing you receive is determined by your substance abuse professional and may continue for up to 5 years. This means that the SAP will determine how many times you'll be tested, at least 6 times in the first year. For how long and for what substances, drug and alcohol or both, your employer is responsible to ensure that follow-up testing is conducted, completed, and reported. Follow-up testing is in addition to all other DOT-required testing. All follow-up tests will be observed. How is a urine drug test administered? Regardless of DOT agency requiring drug testing, and drug testing process always consists of 3 components: the collection, the testing at the laboratory, and a review by a medical review officer. Overviewing a DOT test. Notification: you're being notified to submit for a test. Why? They have to tell you it's a pre-employment, reasonable suspicion, random post-accident, return to duty, or follow-up test. You report immediately to a collection site. The urine collection verifies your ID. You have to empty your pockets. Select a sealed, provided 45 milliliter urine catch collector. They're going to check the temperature and pour it into 2 bottles. You have to watch the collector seal and bottle A and B and sign the paperwork. Lab analysis of bottle A results are sent to the MRO. Medical review reviews the lab results and determines may interview you or request you to be examined by a physician. So it depends on the results. They may have to interview or request you to be examined by a physician. Employees' rights upon notice of by MRO. You have 72 hours from the interview to have a bottle B tested by another certified lab. That's why they split the tests. Okay? If you don't like the results of A, you can have bottle B tested, and under another certified lab, your choice who you want to send it to. A medical review officer verifies the results to the employer as either negative, positive, a refusal, or canceled. Yes, DOT regulations require MROs to report your medication use information to the third party, your employer, healthcare provider, when discussing your medical qualifications. If the MRO determines in his or her medical judgment that you may be medically unqualified according to DOT regulations, or your continued performance is likely to pose a significant safety risk, the medical review officer may report this information even if the MRO verifies your drug test as negative. Prior to the MRO reporting your information to a third party, you'll have up to 5 days to have your prescribing physician contact the MRO. You are responsible for facilitating the contact between the MRO and your prescribing physician. Your prescribing physician should be willing to state to the MRO that you can safely perform your safety-sensitive functions while taking the medication, or consider changing the medications to one that does not make you medically unqualified or does not pose a significant safety risk. Okay. That's if I disclose my prescribed medication. Will a MRO report it to a third party? And the answer to that was yes. What are medical review officers? Medical review officers are licensed physicians with knowledge and clinical experience in substance abuse disorders. They must also complete qualification training courses and fulfill obligations for continuing education courses. They serve as independent, impartial gatekeepers to the accuracy and integrity of the DOT drug testing program. All laboratory results are sent to an MRO for verification before a company is informed of the results. As a safeguard to quality and accuracy, the MRO reviews each test and rules out any legitimate explanation before verifying the results as a positive, alterated, or substituted test. How is alcohol test administrator? The DOT performs alcohol testing in a manner to ensure the validity of the testing as well as provide confidentiality of the employee. At the start of the test, the STT or BAT, using only DOT-approved devices, will establish a private testing area to prevent unauthorized people from hearing or seeing your test results. Require you to sign Step 2 of the alcohol test form. Perform a screening test and show you the test results. If the screening test results is an alcohol concentration of less than 0.02, no further testing is authorized. There is no DOT action to be taken. The technician will document the results on the ATF approved, provided you with a copy and your employer with a copy. If the result is 0.02 or greater, you'll be required to do a confirmation test, which can be only administered by a BAT, breath alcohol tester, using an EBT device that the BAT will wait 15 minutes but not more than 30 minutes before conducting a confirmation test. During that time, you are not allowed to drink, smoke, belch, put anything in your mouth, or leave the testing area. They must perform an air blank, which must read 0.00 on the electronic breath test device to ensure that there is no residual alcohol on the EBT or the air around it. Perform a confirmation test using a new mouthpiece. Display the test results to you on the EBT and on the printout from the EBT. Document the confirmation test results to the ATF provided you with a copy of your employer and a copy. Okay, so the ATF will provide you with a copy and your employer with a copy. Report of any results of 0.02 or greater is going to be reported immediately to your employer. If after several attempts you are unable to provide an adequate mouth breath, the testing will be stopped. You'll be instructed to take a medical evaluation to determine if there's any acceptable medical reason, that there is no legitimate psychological or physiological reason. The test will be treated as a refusal to test. Results. Actions. Less than 0.02, no actions required. 0.02 to 0.03, FMC requires you to do not resume safety-sensitive functions for 24 hours. Okay. At 0.04 or greater, immediately removal from safety-sensitive functions. You may not resume safety-sensitive functions until you have successfully completed the return-to-duty process with an SAP. Should I refuse the test if I believe it was unfairly selected? No. Rule of thumb, comply. Then make a timely complaint. Okay? If you are instructed to submit to a DOT drug or alcohol test, you don't agree with the reason for or rationale for the test, take the test anyways. Don't interfere with the testing process or refuse to test. After the test, express your concerns to your employer through a letter, to your company through whatever process they have for filing grievances. You can also express your concerns to the FMCSA at 202-366-2096 or through the fmcsa.dot.gov Drug Alcohol Program Office. Whomever you decide to contact, please contact as soon as possible after the test, okay? If you refuse, that's a refusal, and you have to go through an SAP to get your job back, okay? You'll be gone from work for at least 6 months, okay? Take the test. It might come back as a negative. Okay, if it comes out as positive, that's something to complain about, that it wasn't done properly, or you weren't doing safety sensitive functions, or whatever your rationale is for not taking the test. Take the test. File a complaint. Okay, do it the right way. If you refuse, your complaint is going to go right out the window. What is a refusal for drug testing? DOT regulations prohibit you from refusing a test. The following are some examples of conduct that the regulations define as of refusing a test. Fail to appear after being directed to do so by your employer. Fail to remain at the collection site until the testing process is completed. Okay, you have to wait till they tell you can leave. Failure to provide a urine sample for any test required by the federal regs. Fail to permit the observation or monitoring of you performing a urine sample. Okay, they have to watch you pee in the cup. You can't refuse them from watching you. Okay, you have to allow that. Failure to do that, it's a failure. It's a refusal. Failure to take a second test when directed to do so. Failure to undergo a medical evaluation as part of shy bladder procedures. So if you say you can't go, they're going to give you a medical evaluation, see whether or not the reason is a shy bladder. Okay, if that's the reason, you've got a legitimate excuse. If it's not, they're going to make you pee in the cup. Pee in the cup if you can. Okay, providing a specimen that is adulterated or substituted. Okay, if you put something in the urine or try to dilute it with water or substitute it with another sample, that's just going to get you in trouble. Don't do those things. Failure to cooperate with any part of the testing process. Refuse to empty your pockets when directed by the collector. Behaving in a confrontational way that disrupts the collection process. Fail to wash your hands after being directed to do so by the collector. Failure to follow the observer's instructions during direct observations to raise your clothes above the waist, to lower clothing and underpants, and to turn around to prevent the observer to determine that you have any type of prosthetic that could be used to interfere with the collection process. Possess or wear a prosthetic or any other device that could be used to interfere with the collection process. Admit to the collector or the MRO that you adulterated or substituted the specimen. Refuse an alcohol test. Fail to appear for any test after being directed to do so by your employer. Fail to remain at the test site until the testing process is completed. Failure to sign Step 2 of the alcohol testing form. Failure to provide a breath sample for any test required by the federal regulations. Failure to provide sufficient breath sample when directed, and it has been determined through a medical evaluation that there is not adequate medical explanation for the failure. Failure to undergo a medical evaluation as part of shy lung procedures. Failure to cooperate with any part of the testing process. Okay, you have to comply, or it's a refusal. What happens if I test positive, refuse a test, or violate an agency's drug or alcohol rule? A supervisor or company official will immediately remove you from DOT regulated safety sensitive functions. You're done working. Okay? Your results will be entered into the Drug and Alcohol Clearinghouse. You will not be permitted to return to performing DOT regulated safety sensitive duties until you have. Okay? Until you've undergone an evaluation by a substance abuse professional. Successfully completed any education, counseling, or treatment prescribed by the SAP prior to returning to service, and provided negative test results for drugs or any test results less than 0.02 for alcohol on your return to duty test. Upon returning to a safety-sensitive job, you'll be subjected to unannounced testing for drug and alcohol no less than 6 times during the first 12 months of active service, with the possibility of unannounced testing for up to 60 months, as prescribed by the SAP. These tests will be directly observed tests. What are substance abuse professionals? Under the DOT regulations, SAP plays a critical role in the workplace testing program by professionally evaluating employees who have violated drug and alcohol rules. SAPs recommend appropriate education treatment following follow tests, and aftercare. They are the gatekeepers to re-entry program by determining when safety-sensitive employees can return to duty. SAPs are required to have certain background and credentials, which include clinical experience in diagnosis and treatment of substance abuse-related disorders. They must also complete qualification training and fulfill obligations for continuing education courses. While SAPs do not make recommendations to the employer about an employee's readiness to perform safety-sensitive duties, SAPs are neither an advocate for the employee of the employer. They make return to duty recommendations according to their professional and ethical standards, as well as DOT regulations. Remember, even if a SAP believes you're ready to return to work, an employer is under no obligation to return you to work. Under the regulations, hiring and reinstating decisions are left to the employer. If you violate a drug or alcohol rule, your employer is required to provide you with a list of SAP's name and address and phone numbers. You can also look up the SAP on the Drug and Alcohol Clearinghouse website or saplist.org. Okay, this is true even if your employer terminates your employment. So how do I find an SAP? The DOT regulations do not address employment actions such as hiring, firing, granting leave of absence. All employment decisions are the responsibility of the employer and the drug and alcohol violations policy. Okay. Will my results be confidential? Yes, your drug and alcohol results are confidential. An employer or service agent is not permitted to discuss your test result to outside parties without your consent. But your test information may be released by law to provide records of your drug and alcohol testing history without your consent. In certain situations, such as legal proceedings, grievances, or administrative procedures brought on by you or on your behalf, which results in a positive test or refusal. When information is released, the employer must notify you in writing any information that was released. Will results follow me to different employers? Yes, your drug and alcohol testing history will be captured in the Drug and Alcohol Clearinghouse. And new employers looking at hiring you must check the clearinghouse before they can hire you. You'll have to give consent to the clearinghouse to release this information. Failure to give consent to the information will mean that the employer will not be able to hire you for safety-sensitive position. This is to ensure that you have completed the return to duty process and are being tested according to your follow-up plan. What should I do if I have an abuse problem? Seek help. Jobs performed by safety-sensitive transportation employees keep America's people and economy moving. Your work is a vital part of everyday life, yet by abusing drugs and alcohol, you risk your own life, your co-workers' lives, and the lives of the public. Most every community in the country have resources available to confidentially assist you through the evaluation and treatment of your problem. Also, many workplace programs are also in place to assist employees and family members with substance abuse issues. Employee assistance programs vary considerably in design and scope, if your employer has one. Voluntary referral programs often sponsored by employers, and union referral programs allow for self-reporting to your employer a substance abuse problem before you violate testing rules. Self-reporting after you have been notified does not release you from your responsibility of taking these tests and does not qualify as a voluntary referral. So what that means is if you self-report, okay, before you get notified for testing, okay, they're going to give you help. If you're notified for testing and then you self-report, it's too late. You still have to test, and whatever the test results are, that's where they lay. Topics may include the effects of drugs and alcohol use, company testing policy, DOT testing regulations, the consequences of positive tests. Materials may also contain information on how employees can get in touch with their employees' assistance programs and community service hotlines. In addition, supervisors sometimes receive additional training in the identification and documentation of signs and symptoms of employees' drug and alcohol use that trigger a reasonable suspicion test. Did you know that 6 out of 10 people suffering from substance abuse problems also suffer from mental conditions like depression? Research has long documented that people suffering from depression try to self-medicate themselves through alcohol and other drugs. Typically, many of these individuals fail to remain clean and sober after rehabilitating because of underlying medical issues. If you have a substance abuse issue, there are a 60% chance that you are also suffering from an underlying mental condition like depression. Increase your chances, ask your doctor or other health professionals about depression as it relates to substance abuse issues. Don't wait. It could mean your job. Find out more about the ODAPC available to answer questions of Part 40. Visit their website at dot.gov ODAPC/employee. For more information on safety training or general commercial vehicle regulations, visit our website and call the MTA Center for Truck Safety at 800 MTA MTA4 option 1. Thank you for watching our video today. I hope this helps you understand the rules and regulations for drug and alcohol testing as a driver. My name is Eric Kestela with the Michigan Center for Truck Safety. Have a great day.